Yes. Okay. So this is our channel. If you are not aware of this one, just click on this one and you'll go to YouTube, subscribe there so that you will know. Even if you miss any session, you can check it out there. Not all the sessions I put there, because some special sessions I keep them for my regular students only. Very rarely I put there. But whenever I put, you can go there and you can watch. So you can subscribe there so that you can watch them on a regular basis. The number of audios, videos, you can follow them. Right. Okay. That's it. Okay. So we have seen, right? Once again. So that was hypertension. The title is hypertension. Title is hypertension. Title is Simon's left hand. Every finger has a label. So this is Simon's left hand. This is Simon's right hand. This is thumb. Simon's left thumb. Simon's right thumb. Both are thumbs. This is left thumb. This is right thumb. This is left little finger, little John. This is right little finger. Now, middle finger, pointing finger, ring finger. So thumb, 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 thumb. Pointing finger, middle finger, ring finger, little finger. So every finger has a name. In the same way, here there are no names. So you give the names. Then it will be easy to go there. Fine. This is the first paragraph. No name was there. So I gave the name, medications. That was quite clear. Fine. So this is medications. You can see here. So this is medication. This is medication. This is medication. So now what I did, I gave a title for that one. This title is A. It is for medications. So this is for medications. So simple. Okay. Right. So every paragraph you give a label like that. No, don't hurry. If you hurry, you'll fall down afterwards. So don't hurry. Step by step. So text A, we have noticed that text A is related to medication. And we gave it a name. That means if anything, a name of medication, drug, analgesics, injections, or whatever it is there, you'll come here. That's it. That's very clear. How to compartmentalize. There's a train. A, B, C, D. Sleeper S1, S2, S3, S4. So like that, there are compartments. So you have to understand the labels of the compartments. Now next, text B. This is text B. What does the text B say here? We'll go to text B. Text B is this one. Controlling high blood pressure from there. Okay. From here onwards. Till here. Yeah. Okay. Okay. Fine. No problem. Little hard work. Okay. Controlling blood pressure. Okay. Fine. Okay. To find out some solution. That's all. Yeah. So this is yes. So we have 1, 2, 1, 2, 3, 4, 5, 6, 7. So why you should tell me that one? Okay, 1, 2, 3, 4. 1, 2, 3, 4. 5, 6, 7. So 1, 2, 3, 4, 5, 6, and 7. Okay. So it starts with advise, patience, encourage. Okay. First one is advice to limits, advice to consumption. This is one. The next one. Next one is females. Okay. Third one is till week. 3. Then fourth one is recommend to vegetables. Recommend to vegetables. Okay. Number 4. Advise to regularly. Huh? Okay. Checkup appointment, patients appointment, then provide to depression. Yes. So this is 32 aerial. So it is little higher side, so reduce a little. 28, 26, still it is higher. So 24, 22. Okay, fine. 21. Okay, that's it. You can see there. Okay, and yeah. So this is how it is. Yes. That is hypertension medications. Hypertension medications. And these are controlling measures. That is medications. These are controlling measures. Controlling measures, controlling high blood pressure. Here subtitle is already given. Controlling. How to control? Means how to avoid some things or how to do some things, or that means do's and don'ts. Do's and don'ts. That means regulations. That means rules. That means suggestions. That means advice. That means recommendations to precautionary measures. Avoid. Okay. This is how it is. This is text B. Now, I told you number of words. I hope at least one person is writing that one. Because afterwards, you will not get these things. I'm slowly telling you all these words. Okay, fine. Now here, write down the words. Because these words only will come in the questions. Controlling. Managing. Okay. Avoiding. Restricting. To stop. To prevent. Okay. To control. All these words will come there. So this is, you can understand here. Some do's and don'ts. Write down do's and don'ts. Some regulations. some suggestions, rules. Recommendations, guidelines, measures, preventative measures, control measures. So all these words may be there in that. So that means synonyms are very important. Okay, controlling high blood pressure. That is medication. That is medication. This is management. Management. So you can say rules and regulations or do's and don'ts. How do you know that it is do's and don'ts? Recommendations, suggestions, advice. Okay. Guidelines. Guidelines. So what we can do is you can take the word guidelines here. So you can take the word guidelines. Guidelines. Do's and don'ts. Guidelines. We can say this is guidelines or some do's and don'ts. Yes. So this is what the label you have given. Guidelines. Now, if this is guidelines, now how do you know that guidelines? Now he says here, he will tell you some points. I'm going to show you the synonyms there. I'm going to show you the synonyms here. So here it is advise, it means to do something. Advise patients to stop. That means recommendations, guidelines, suggestions. Do's and don'ts. Don't do this, do this. To stop smoking. Stop smoking. Means don't do smoking. Don't do smoking. That is what it is. Do's, don'ts. Patients can use nicotine aids. Patients can use nicotine aids. Means you can use nicotine aids. You can use nicotine aids. Yes, do, no problem. Do nicotine aids. That is what it is. Do use nicotine aids. Join local stop smoking schemes. Join local stop smoking schemes. Okay. If unable to quit smoking, encourage them to reduce daily cigarette consumption. Reduction. Stop smoking is not possible, at least to reduce. Stop smoking. Don't smoke means do not. Don'ts, do's and don'ts. Stop smoking means don't smoke. Next one, if you cannot do that one, reduce smoking. Reduce smoking. One is don't and one is do. If that is not possible, do this. Don't smoke. If not smoking is not possible, then reduce smoking. At least do this one. So, do's and don'ts. So here he is telling one word suggestions. Reduce. Stop. Join. Okay, advise. So you can see all these words. Must. Must means do. Must not means don't. Must not means don't. Must not means don't. So do's and don'ts, that's very clear. Encourage regular exercise means to do. Do this. Do what? Exercise. Recommend a balanced and healthy diet means do. Recommend means do. Prohibit means don't. So you have to understand recommendation. I told you already. It will be there. Advise, suggestion, suggest. Okay, suggest, recommend, encourage. Encourage means do. Don't encourage means don't. Recommend means ask them to do. Prohibit means don't. The same words will be there. You try to find the answers here, you will not get. The same words from here you will get. Should. Should means do. Must means do. Must not means don't. Should not means don't. Advise. Should. Provide means do. Offer. Advise. Recommend. Everywhere you see such words. Whenever you use these words, you should remember that these are do's and don'ts. Do's and don'ts means controlling. Don't do this, you are controlling. Do this means permitting. Permitting and controlling. Permitting and prohibiting are together controlling. Positive controlling is permit. Negative controlling is prohibit. Permit, prohibit. Permit, prohibit. Permit, encourage. Recommend, suggest, advise. Don't do it. Abstain. Smoking cessation. Alcohol reduction. Must not. Prohibit. Withhold. Refrain. Write down these words. Write down these words. I only don't remember always. When it comes, automatically write down. Refrain. R-E-F-R-A-I-N. Refrain. Stay away. Withhold. Smoking cessation. Cessation means stop. Reduction means reduce. Abstain. A-B-S-T-A-I-N. Abstain. Refrain. R-E-F-R-A-I-N. Refrain. Withhold. If you learn now these things, every test you can remember. If you don't know now, every test you will break your head. One time, finished. If you look, it is like this. You buy a house or build a house, one time headache. Finished. No headache anymore. But if you live in a rented house, every month headache. Every month headache. Okay. Every year headache. Every problem headache. So because it is not your own house. So like that one. This is not your vocabulary. So learn vocabulary. One time solve it. Solving one time. Right. So these show that these are guidelines, or you can say do's and don'ts. Do's and don'ts. Many people think this is not important, but they don't know what is important. They themselves cannot judge what is important and what is not important. Okay. Fine. Enable. Disable. Allow. Restrict. Write down the words. Allow. Allow means controlling. Restrict. Allowing somebody, restricting somebody means controlling. permit. So all these words are related to this. Write down do's and don'ts, must and must not, can and cannot, ought and ought not, should and should not. So these are the words. All different styles I have told you. So if you learn this one, it will be easy for you. Now for us, exam questions will be very easy. So only this one, no need to do all these things. For you, I am telling you. I already know from the title itself, controlling. Controlling means controlling. Do this, don't do this. That is called controlling. That means guidelines, what to do and what not to do. I got it from the first paragraph itself, first subtitle itself, because they have given title. Controlling. I understood from there. So second title is guidelines. Right, guidelines. So here we are. Text B. Text B is guidelines. Text B is about guidelines. Next is text C. Starting it will be a little difficult, but afterwards it will be very easy for you. Right. So the next one is text C. Text C is here. The following are indicators of high blood pressure. Okay. Okay. Right. So there you are. First one is management. Second one is controlling. Now this one is indications, indicators, indicators. Okay, how to identify these things? Using indicators means signs and symptoms. signs, symptoms, indicators, tests, or whatever it is. So these are the indicators. Indicators mean signs, symptoms, suggestions. Okay, fine. These will suggest that you have some problem like that. So the following are the indicators. Indicators. So try to understand there what he is telling you. How do you recognize that a person has high blood pressure? Okay. So these are the 7 things he has given you. The following are indicators of high blood. That means how do you know? That means identification of high blood pressure. So if you want to know that somebody has high blood pressure, you should go through all these 7 things. If everything out of these 7 things, all are there, that means 100% blood pressure. If 1 or 2 are there, maybe there, chances 20%. If 4 are there, 60%. All are there, 100%. Not even 1 is there, 0%. So that is it. The more the symptoms, the more definite the problem. So with these symptoms, you are going to diagnose. Okay, fine. Let us see here, because answers you will find very easily. Don't worry. How to identify what it is talking about, that is more important. So here, now let us see where and where it is there. Headaches, nosebleeds, blurred vision, dizziness, shortness of breath, chest pain, numbness. Symptoms. If chest pain is there, that means there is some problem. What is the problem? Blood pressure. Shortness of breath is there. You are not able to breathe properly. Shortness of breath. Difficulty, great difficulty you are able to breathe. That means you have a problem. What is the problem? Blood pressure. Maybe. Dizziness. You are dizzy. You cannot, Blurred vision. Okay. All these things. So these are what? Symptoms of problem. You are having a problem. That's why you have shortness of breath. So you go. So if there is dizziness, that means there is some problem. That's why you have dizziness. Problem is cause. Dizziness is effect. Cause and effect relationship. Problem, input, output. You are able to see that one. You are able to notice that one. That is the sign for some problem inside. Frequently nose bleeding. What is that? Nose is very sensitive. It cannot hold the tension, suppose. So frequently it is bleeding. Frequently, not once or twice, lot of times. For a normal person, it doesn't bleed. Fine. And sudden and recurrent, again and again and again. Severe, sudden and recurring. Severe means high level pain. Sudden, immediately coming, and recurring again and again. So such symptoms. So these are signs and symptoms, you can say. Signs and symptoms means indicators. Indicators means signs. Indicators means symptoms. These symptoms are suggesting. So suggesters. They are suggesting. They are telling. They are prompting. Prompts. Cues. Prompts. 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 Cues. You are getting a cue. Clues, C-L-U-E-S, clues. It is a clue. It is a clue. It is an indication. It is a prompt. It is a sign. It is a symptom. How many synonyms I gave you? I gave you a number of synonyms. Indicators, signs, symptoms, cues, prompts. Anyone may be there. Fine. That's it. So, first one is medication. Second one is controlling. First one is medication for hypertension. You know that you have medication. That means diagnosed. You are diagnosed with hypertension, so you have to take medication. So in order to diagnose, not to get this problem, so make it serious. You are already diagnosed, so you are taking medication. Medication is one. Then afterwards, other things also you have to do other than medication to control this one, to prohibit with this one, to limit this one. That is controlling. And how will you control? You should know these are the reasons. Then only you can control. So if you want to know, you need indicators. Indicators to control the indication to control and along with medication. See here, three different things. Medications, hypertension. I have hypertension, so I am taking medication. I have hypertension. I should not get into deeper problem, so I have to control some things. I have hypertension. How do I know? Indicators. So indicators, controlling measures, medications. So we are giving four different branches now. Simon, Mr. Simon, Simon's right hand, Simon's left hand, thumb, pointing finger, middle finger, ring finger, little finger. So like that, every text has its own label. You have to identify what it is talking about. In the first paragraph, only about medications will be there. In the second paragraph, only recommendation, do's and don'ts will be there, because it is controlling what to do and what not to do. Those only will be there. Rules and regulations. In the third paragraph, how to find out that you have hypertension. Indications. This is different. Only indications will be here. That's it. If you say in the kitchen, kitchen things will be there. In the bedroom, bedroom things will be there. In the living room things will be there. That's all. They are watertight compartments. Write down. Watertight compartments. What do you mean by watertight compartments? For example, in your house, your family members only will be there. Neighbors' family members will not come and stay in your house. Why? Because it's a watertight compartment. That means it is permitted only for your family members. Mr. John's family, Mr. John, Mr. John's wife, Mr. John's daughter, Mr. John's son. That's all. It's a watertight compartment. Mr. John's family means only, that's all, only. There ends the matter. Mr. Adam's family, only Mr. Adam and his wife and children. Adam's father also maybe. Adam's mother also maybe. Adam's sister, Adam's brother. Oh, that's okay. Everything related to Adam. Without the label of Adam, nothing. Adam's brother also labeled Adam. Adam's sister also labeled. So like that one. Everything related to Adam. That is called watertight compartment. That means nothing can come. Watertight. Watertight means water also cannot enter into that compartment. That much tight it is. Watertight. Nothing can go into that. So every part is a watertight compartment and only related to that will come. First one, only medications. Second one, only do's and don'ts. Third one, only indications. Nothing, nothing, and nothing. I hope you understand. Next, number 4. Okay. Here, let us see. Okay. Fine. Please don't share this link with anybody. If they want to watch, what, let them watch. But I don't want anybody here. Only my students. Okay. Even if there are 4 or 5 also, it's okay. Least bothered. Okay. Now here, try to understand very clearly one particular thing. Try to understand one particular thing. One thing I did not do is doctor's group. I did not send. I made a mistake. 1 second. Okay. Right. This is doctors. Yeah, 4th paragraph we are coming. But in this paragraph, identify what are indications. That is very important here. Yes. So now, indications. So here we can understand that this is related to, what's that? Where is this? Yeah, here it is. Yeah. So these are indicators. Indicators means, let us take an ordinary word, signs and symptoms. Signs and symptoms. Signs and symptoms. Signs and symptoms. So this is related to signs and symptoms. That's fine. This is related to signs and symptoms. Yeah. Signs and symptoms. That is fine. Okay. So if this is signs and symptoms, what are signs and symptoms? Let us see. Let us see. These are symptoms. Chest pain, numbness. These, the following are, all these 7 are signs and symptoms. So all the 7, there are 7 indicators here. Indicators is the key word here. Indicators is the key word here. That means signs, symptoms, prompts, cues. Signs, symptoms, prompts, cues, suggestive of, identifiers. You identify with these things. Okay, that is how it is going to be. Right, 7. Okay, why you have to identify, why you have to indicate, why you have to find out, why you have to discover, why you have to diagnose? Because if you diagnose only, you can control it or you can reduce it. So control has gone earlier, and how to control will be there in the first paragraph. Medications, with medications and other things. Even if you take medications, everything cannot be cured. So in order to control properly, you have to do some exercises, you have to take the diet and many other things. So that is what it is. So next. Okay. So these are the indicators. If you indicate, if something is indicating, that means you are able to see the signs and symptoms and you are able to diagnose some problem. And by diagnosing that problem, you are going to control it by 2 ways. One is medication and other than medication, management. Medication, treatment. Management by controlling some habits and other things. Right. So this is C. This is C. Fine. Next we have D. The last one finished. So we are going to find out the answers immediately. It's very, very, very easy. Okay. Right. C, D. Okay. Why this has come? Okay. C. Okay, this is D. This is D. Okay. This is a D. Now here what I am going to do is I cannot do anything here. So what I'll do is I'll take the picture as it is. That would be better. Edit, take a snapshot, take this as it is. Okay. Copy selected graphic. And now what I am doing is, okay, remove this. Okay, and put this here. I have put it there. Okay, that's very clear. Now we have the table. Now there is something more to it. What is that? Here, the table below shows this one is missing. Okay. Yeah. Only that part is missing. I'll take that now. See. Okay. Right. Now I have taken that one. I'm going to post it here. Sorry. Right. So there it is. Okay. 18, 20, let me see. 20, yeah, I think it will do. Yes. Okay, we have fit in there. Yeah. So now this is paragraph number 4. Paragraph number 4. So this is, write the labels, categories, types, kinds, classes, varieties, styles, manner. Okay, all these things you can see. Degrees, levels, all these things. Okay, so now you can see systolic pressure, diastolic pressure. You know all these things. I need not teach you all these things because you are already medical professionals. I should teach you only English. So only English I am teaching you. Yeah. So you can see that there very clearly. The table below shows the systolic and diastolic values for normal, abnormal blood pressure. Abnormal again is 2 types. One is above and below. Normal is normal range. Abnormal may be above and below. Hyper and hypo. Hyper, hyper, hyper means hyperactive, means too much active. Hyperactive means too. My son is hyperactive. He doesn't stand or stay at one place even for a second, sir. Hyperactive, too much active, too much, too much, too much. Hyper, 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 hypo, hypo, down, below. Average, above average, under average. Average means normal blood pressure. Abnormal is two types. Not normal. That means not normal means it will be upside or downside. Both are not normal. One is positive and one is negative. Problem. So hyper means above. Hypo means below. So that is it. You have to understand there. Now here, there will be an order here. Hypo, hyper. So low level to last higher level. There's an order you can see here. Systole and diastole. See there, that also. First systole, then diastole. There's an order. There's a, there is something called organization. Many people write without organization. Oh, headache. Difficult to understand. So here, if you write organized way, you can understand it very easily. Why answers are able to be discovered easily? Because they are organized in such a way. See, 70 onwards, slowly increasing and going to 180 to 200. That is what it is. Hypertension also, see, mild hypertension, moderate hypertension, and severe hypertension. See there, going in an organized way. That's it. It is easy for you to understand. Right. 1 second. Text D is related to this. Now coming to the point here, if this is text D, there are two different things here. What is this talking about? This is talking about 1, 2, 3, 4, 5, 6 categories of hypertension. So, blood pressure. 6 categories of blood pressure. You cannot say hypertension. Because normal, then no hypertension. No? Normal means no hypertension. That's very clear. Normal means no hypertension. So these values for normal and abnormal. So blood pressure levels. Blood pressure levels. Try to understand that one very clearly. So either it will go from low value to higher value or higher value to low value. Normally, anytime you remember one thing, it will go from 0 to 10. You will not say from 10 to 1. You will say from 1 to 10. Only in countdown you say 10, 9, 8, 7. That's it. So it's an order. It's an organization. So now this topic is related to category. Try to understand this one. You are coming now, finished, almost finished, last part. And it is easy for you. So this is categories. This is categories. Categories. This is categories. And how many categories are there? 6 categories of blood pressure. Some are normal and some are abnormal. And in abnormal, there are some are hypo and some are hyper. In hypo, there are hypotension, normal blood pressure, you can see. Hypotension means less than that is hypotension. Normal blood pressure, then pre-hypertension, then afterwards 3 stages of hypertension. Okay. So there are categories. Write down the words. Categories, groups, varieties, types, kinds. Afterwards, somebody write Prabjit, Sangeeta, or anybody. Okay, those who are students, okay, those who are serious, you can make notes of it because I'm not, I cannot do that one now. Okay, so you can make the notes and afterwards you can put it in the group or the Telegram channel or send it to me, whatever. But if you send it in the group, it's better. So, classes, divisions, departments, zones, areas, compartments, stages, levels, values, all these things will be there in the questions. Will be there in the questions. So I'm going to play the game with you now. Follow that one very clearly. Yes. Others cannot understand. They cannot understand what we are doing here because we do number of things. So those who are live session here, okay, I'll teach you how to select step by step. But there I finished. So they have to do it. I can wait for you here, but on the YouTube, nobody will wait for you. It will go on. Here, if you have doubts, you can ask me. In the YouTube, you can never contact me even. Okay, so that's why don't miss the regular session. Never miss the regular session, please. Fine. So these are the 7 different types. Yeah, we are jumping from. These are the passive. This much only you have to do. This is called skimming. Only skimming is enough for this one. Only skimming. Only skimming. Nothing else. Okay. Print screen. Yes. There's only one word we have to take from there. That is categories. Okay. Yeah. So now coming to the point. Where is this? Where did it go? Okay. Fine. So we have 4 texts. Here it is. Cancelled. Okay. Now, the 4 texts. The 4 texts. So we want subtitles for that. Titles we already know. We want subtitles. That is the meaning I am telling you. We want subtitles. And those subtitles, sorry. Yeah, the 4 subtitles. Number 1, text A. Text A. Text A is medications. Text B, indications. Text C, text C. Sorry, text. The C is indications. Text B is regulations. Regulation means rules and regulations, means controlling. Control. You have to find out the names for that one. Medications, regulations, indications, medications, regulations, indications. See how I am showing you there. Text D. Categorization. categorization. So they are divided into categories, categorizations. Okay, how to this group, this group, this group, you are separating to different groups. So that is it, all shuns. So there you are. Yeah, the 4 text subtitles. Now you know text A is related to medications, text B is related to regulations, text C is related to indications, text D is related to categorizations. So these are very important for you to identify the 4 texts. If the question is asking about medications, you will go to. If the person is asking you, I want a spoon, you will go into kitchen. If the person is asking you, I want a pillow, you will go into the bedroom. If a person asks, I want the TV remote, then you will go into the living room. That is it. Now you know the orientation, where what is, where is what. It will take time for you to understand, at least 2 days, 3 days. If you can understand it, then afterwards it will be very easy for you. Okay. So if you are saying some medications, then you will go to A. If you're saying some rules and regulations, do this, don't do this, prohibit this, avoid this, then you will go to text B. Then if you're saying pointers, another word, pointers, indicators, pointer, another word I'm saying, pointers. Revelation, it reveals, it indicates, it shows. So like that. Then indicators, see, categories, different types of. So first one is medications for hypertension. Second one is regulations for hypertension. Third one is indications for hypertension. Fourth one is categorizations for hypertension or categories for hypertension, categories of hypertension. So everything is related to hypertension, hypertension. Text is hypertension, we know that. And now like Simon's left hand, hypertension. But in the left hand, Simon's left hand has only 4 fingers. 4 paragraphs. First one is thumb, A, B, C, D. A is thumb, 2 is pointing finger, 3 is middle finger, 4th one is ring finger. That's all. In the same way here, Simon's hand is hypertension. A is related to medications. B is related to do's and don'ts, regulations. C is related to indications. D is related to categories. So this is hypertension. This is medications of hypertension. This is regulations of hypertension. This is indications of hypertension. This is categories of hypertension. That's all. Once I tell you, some people are there, sir, you are taking too much, sir. Yes, it is a headache for me only, no problem. It's a very difficult topic. Many people are suffering because they don't understand what it is. So, if you don't have time, no problem. Stay away. Stay away from this session if you don't have time. If you are in a hurry, yes, find your solution somewhere. And don't force me, sir, fast. Poor people, many people are there who are starting from the beginning. If you are experts, okay, wait, don't enter this session. You can do directly. And then just check it out. This session is for those sessions who want to learn. This session is not for those students who will force me. Come on, sir, fast. No, because there are many things I have to explain here. Yeah. So here, this is how you have to identify. Now you will take little time, but later, just at a glance, you can understand what it is about. So if you identify this, then answer is very, very easy. So this is the first part of the session. This is called skimming the texts, skimming the passage, skimming the texts. So what is it about? What is it about? What is it about? What is where? That's all. Not finding the answer. This is called skimming the test. In skimming the test, there are two stages. Write down. Number one, read the title and understand what it is about. This text, the title is, okay, I'm taking you there now. Yes. This is the title. This is the title. That means this is all about hypertension and nothing else. This topic is 100% hypertension. So what is hypertension? What are the reasons for the hypertension? What are the causes of hypertension? What are the effects of hypertension? What are the advantages of hypertension? What are the disadvantages of hypertension? What are the reasons for hypertension? What are the preventative measures for hypertension? What are the treatments options for hypertension? What are the medications for hypertension? What are the rules and regulations when you have hypertension? What are the indicators to find out that you have hypertension? What are the different levels of hypertension or types of hypertension? All these different things will be there. And you have only 4 texts. Any one come from this. Any 4 can come from this. That's all. There are many things. 20, 30 things will be there. And if 4 only will be selected and put into 4 groups, that's all. They will not mix everything there. So you have to understand that one. That is called title, studying the title. So there are 10 points. 10 points. 10 points. Number A, skimming. Write down. A is skimming. So if A is skimming, what you should do when you take a text in your hands? Number 1, skimming has 2 steps only. Only 2 steps. Skimming has 2 steps. Skimming has 2 steps. Number 1, study the title. And what is the title? What is this about? Now, nothing, only one thing is, this is about hypertension. Then start opening your mind. Hypertension? What is hypertension? When people get hypertension, how people get hypertension? Okay, then where should they go if they get hypertension? What should they do if they get hypertension? What should they not do if they get hypertension? What is actually hypertension? How many different types of hypertension are there? Okay, how do we know that it is hypertension? Okay, what are the medications that we have to take for hypertension? What are the preventative measures we can to avoid hypertension problem? What are the treatment options for hypertension? All these should come into your mind. When they come into your mind, automatically you can identify in the next step. Number 2, identifying subtitles. That is number 2. If you think like that, then only you will know what is in the next paragraph. Okay. Subtitles. Sometimes they will be written, sometimes they will not be written. If it is written, it's easy. If it is not written, it is difficult. You have to find out. If you do not find out, it will be very difficult for you. Now we have seen that there are four texts. So compartmentalized, we are made into 4 groups. First one is regarding medications only. Second one is about regulations only. Third one is indications only. Fourth one is compartment categories only. There are school bags in the house. One is elder sons. Second one is, there are bags. There are bags in the house. One is father's bag, one is mother's bag, one is son's bag, one is daughter's bag. That's all. In son's bag, only son's things will be there. In daughter's bag, only daughter's things will be there. All are bags. All is related to hypertension. That is what it is here. How things are groupified, classified, categorized, divided, separated, segregated, compartmentalized into 4 different groups here, 4 different texts here. If you don't identify, for every question you will break your head. If you identify these like that without even going into the text, you can say this is A, this is B, this is C, this is D, because A is medications, B is regulations, C is indications, 4 categories. You need not go to the passage again. If he says medication, medication is where? A or B or C or D? A. Types of hypotension, where? A, medication, no. B, regulations, no. C, indications, no. D, categories. Yes. Severe hypertension. Severe is a type, category. It's a class of hypertension. So where you will go? A, no. B, no. C, no. If somebody says C, shut your mouth, you will say. Useless fellow, you can't understand. It's very clear here. How can you say it is in C? You're mad or what? You will say with great confidence. Because the question is asking severe hypertension. Where will you find? A person has 280. Is it 280? Okay. So you have to find out there. Now if it is, 180 to 209. So what should you do in the case of which class is it? If which class, which type, which group, then immediately you will go to categories. That's all. So you can understand so-called directions. It's very easy. Come on. These are the 2 steps. Titles. Study the titles, number 1. Study the subtitles, number 2. That's it. So this is called skimming. Next one is scanning. What you have to scan for? You have to scan for 5 different things. Simon's left-hand rule. 5 diamonds. 5 diamonds. Pick them up. Put into your bag. Number 1 is names. 50% of the questions will be names. Numbers, 20% will be numbers, so 70%. Then new vocabulary, 10%, difficult vocabulary, 10%, special words and phrases, 10%. Total 100% answers you will get. That means where are names? Names will be with capital letters. Numbers will be with different shape. Then vocabulary will be the size. How do you identify these things? Names you can identify because of the capital letters. Numbers you can identify because of the shape. Vocabulary you can identify because of their size. Important vocabulary will be huge in size. Very wide. Contamination is a vocabulary. It's a word. Very big word. So it is special. Maybe you don't know it. First time you are hearing that. That means new vocabulary. You know it, but you don't know its spelling or pronunciation or meaning or word form or usage. 5 different things. Then it is difficult vocabulary. Then 3 or 4 words come together. Then it is called special phrase. You have to understand that. So these are second stage. This is called scanning. Right? Our first one is skimming is done. 2 points. Scanning. 3, 4, 5, 6, 7. That is scanning. So now you have to do scanning A. Scanning A is the questions, passage. Scanning B is the texts, questions. So you have to scan the questions and you have to scan the passage also. If you scan the questions, you will get some words. If you scan the passages, you will get some words. There is some relation that is called synonyms. Here he say categories. Here he will say types. You have to relate that these two say words are same. Then you got the answer. If you cannot relate, then you cannot find the answer. That's it. Okay. That's it. We are not going to find the answers right now. We are going to identify where the answers are. Yes. Yeah. So now, 1 second. I'm going to ask you people one question only, because we are moving into another compartment now. If I move into the other compartment, I will not come here again. That is done and dusted forever. So what you have to tell is skimming. Skimming. Okay. A is skimming. Skimming stage is done. Now I'm asking you one thing. I'm just asking you, understood. And then I'm giving 3 question marks. You have to say only one thing. Just the letter S or YES you write. If you understood, no, write NO, no. 3 words, 3 letters or 2 letters. That's all. Because we are moving forward into the next stage. Skimming stage is done. And we are moving to the scanning stage. Yeah. So don't be neither yes nor no. You can write I don't know, no problem. Or write yes or no. Don't be silent. If at least you say I don't know. Okay, if you don't know. Right. After attempting, please evaluate me where and how I am doing wrong, sir. That we'll see later, because automatically you will get answer here. You will not go wrong because you are going with me. Yes, fine. So we have done it. We have done it. Now we are going to the second stage, that is the questions. Yeah. Now skimming is done. So skimming. Right. Stage 1 is called skimming. Is done. Now stage 2 scanning we are going to do. Skimming is done. Scanning we are going to do. Yes. Okay. The 3 stages. The 3 stages of reading. The 3 stages of reading. What are the 3 stages of reading? Number 1, skimming. Number 2, scanning. Number 3, solving. 3S technique. 3S technique. Okay. 3S technique. So skimming, you have 2 steps. That is studying the title and studying the subtitles. Scanning, you have 5 aspects. One is you have to do underline, read, type names, then numbers, then new vocabulary, then difficult vocabularies and special phrases. These are the 5 aspects you have to underline. Next while solving, you have three steps or three measures you have to take. Okay, fine, that we'll see later. So scanning, and scanning you have to do in reading passage and reading questions, right? Yeah, now here we are. Okay, question number one. One second, where I should go, sorry, where I should go, I have to bring the format. Yeah, reading part A. Yeah, reading part A. Part A, part A, part A, part A. Show more results. Part B. Open. Part A. Okay. Part B. Okay. Yeah. So here question number one. Question number one. Right. Now let us see question number one, what it is telling you. This is question number one. So, okay. Question number one, already we have given number. Okay, these are the directions. Okay. These are the directions. Okay. So this is the direction. Okay. Control C, Control V. Okay. Yeah. Okay. Okay. Fine. Okay. Send to back. So forward. Remove. Okay. Right. Yes. Okay. We have done. Now we are ready. So first one is the instructions. First one, instructions. For each of the four texts A to D, briefly summarize the information given. Okay. Briefly summarize the information given. Okay. A to D, briefly summarize the information given. Okay. That is different thing. So, right. So for each of the four texts, briefly summarize the information given. Okay. These are the texts. Okay. Now, A, B, C, D. There are four things. There are four things. You summarize means what is there in that one you have to write. Okay. Next, look in text A. If you want increased risk of high blood pressure, look in text A. Look in text D to find which category of blood pressure. Okay. Try to understand there. Look in text B. What type of exercises patient should do 2 times each week. Look in text C to find what would happen if patients with high blood pressure made an effort to lower it. So here, increased risk of blood pressure. That means you will find in text A. If you want which category of blood pressure, category means you will go to text B. Okay. Text B. Then if you want what type of exercises, then you will go to text B. Do this exercise, do that exercise, like that. And what would happen if patients with high blood pressure made an effort to lower it? If they reduce, what will happen? Okay. So then you have to go to text C. Like that you have to see. So summarize text, which is what? Try to understand. So increased risk of high blood pressure, where you will find? So you will find in text A. Because text D is about categories. Text B is about types of exercise. Text C is about, reducing or increasing, like that. So now, so in that manner, you have to identify those 4 things. That is the way how you have to follow. Right. Now, this is the same thing. This diagnosis of hypothyroidism in patients taking L-thyroxine. So this is the title given. This is the title given. He has changed the title and is giving a different style now. Okay. Now here there is this much text. Okay. Until you go to text B. So there he has given a little earlier, but now he has given a little more than the previous one. So here text A is only little. Only this much medications. The only medications he has given. Then next one is, okay, text A is medications. And text B, controlling high blood pressure. Text C, indicators of high blood pressure. Text D, categories of blood pressure. Finished, that's all. Now here is going to expand a little more. You already understood everything. Now, right. So here, has given different text here, just to identify. See these things. Text C, mutation testing for thyroid cancer. Okay, text D is thyroid function test results and analysis. Okay. Thyroid function test analysis. Okay. So now the questions are here. D 6 to 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. Okay. Anemia. Okay. Right. Official book. Official book. So reading. Two. Yeah, reading, listening, reading. Yes. Yeah, fine. So, hypertension texts. Text 1, text B, text C, text D. Okay. Now, for each of the given four texts, A to D, briefly summarize the information. That means, that is summary. That means subtitle. We have already given there. We have already done. Already done. So, now you want to text A. The question is asking about an increased risk of high blood pressure. Then go to text A. Then you find there. Increased risk of high blood pressure. Then go to text A. Okay. Then next one. If you think about category, then go to text D. That's what we have learned till now. I already told you. Then next one, if you want about the type of exercises, diet and other things, do's and don'ts, you have to go to text B. That is what we have learned already. So what I have told, the same thing is here. Text C, you have to go to text C. If you want to know what happens if patients with high blood pressure made an effort to reduce, if they reduce it, what happens? You have to go to text C. First one is regarding, you understand now all the different types. You already know. So now, moving further, identify the question types. Identify the questions type. What type of questions are they? That I am going to explain now. Right. First one is, there are four types of questions. There are four types of questions. Okay. There are four types of questions. Yes. The types of questions you have to identify. Types of questions. The four types of questions. What are the different types of questions you will get in part A? What are the different types of questions you will get in part A? So the first one is here. Matching. That means will it go in A or B or C or D? Matching the information with the text. Matching with A or matching with B or matching. This information is matching with A or B or C or D. So matching test. Matching information we call it. Matching information with four texts, which is right. That you are going to see. Next one is sentence complete. Sorry, short answer text. Short answer. Next, second one is short answer. Short, SAQ we say. We say it is SAQ, short answer questions. Short answer questions. First one is matching information questions. Second one is short answer questions. Third one is sentence completion. That means there will be a sentence and it is incomplete. Sentence completion questions. Sentence completion questions. Okay. Next, fourth one is note completion. They will give a type notes 1, 2, 3, 4 or notes, and some notes will be incomplete. So note completion questions. So these are the four different types of questions you should know. Anyone may come. Three will be there. Three different types will be there. Three different types will be there. That's all. Three different types. Okay. Three different types of questions. So make a note down. Make a note of this because nobody will bother about these things because different types of questions have different approach. Different types of question have different approach to answer the questions. Yeah. So, four different types of questions, right? Next, the first task will always be matching. Remember that. That means 1 to 5 or 1 to 6 or 1 to 7 always will be matching to tell you which question is from which paragraph. That's all you should do. Is it the information in A or B or C or D? So 5 questions or 6 questions or 7 questions will be there. So those are very easy. You need not go to the question paper also. Directly here only you'll get. If you analyze like what you have analyzed. Remember that. Okay. Then next one, followed by 2 of the other 3 tasks. Only 2 out of them, not 3, 2. Okay. Right. So you have to refer to the question paper and then you have to answer the question. Okay, fine. So that is, you have seen here, 1, 2, 3, 4, 5 over. 1, 2, 3, 4, 5 over. So then 6 to 25. Question 6 to 25. Now see here. There are some examples here. We already discussed which paragraph is what. That is 1 is over, 2, 3, 4, 5 are over. That's it. A, what, B, what, C, what, D, what. Now let us go to 6 to 11. So now this is the question number 6. This is the question number 6. So in which text can you find information about? So that is the point. Okay. So this is question number 6 here. This is a rough practice test to make you identify. So Control V. Okay. In which text can you find information about continuation? It's not complete. It's continuation. Remember that. So he's asking you there. So that means this is the question. That means red. Red. In which text? In which text can you find information about? That is the question. Finished. Next one. The question is this one actually. Copy. This is the 6th question. So number is not needed. So this is continuation of the previous part. So this is and this one. Okay. 1, 2, 3. 2, 3. Okay. Area. Fine. So 22 or 44. So 40. 36. Right. Identifying the risk of malignant cancer of thyroid. Identifying the risk of malignant cancer of the thyroid. Okay. Yeah. So identifying the risk of malignant cancer of the thyroid. That's it. So that is the point. Next. This is the question. That is the question. So where do you find the information to identify the risk of malignant cancer of the thyroid, for example? Okay. What did he say? Malignant cancer of the thyroid. Okay, he has changed the question. Okay. Cancer. Okay. Now you can see here. Malignant cancer of the thyroid, where you should see the information on pages 71 to 74. 71 to 74. Okay. So further ahead. Yes, hyperthyroidism. Yeah, text A. So he has given that idea. Then afterwards he is giving a different question. Diagnosis of hyperthyroidism. This is called diagnosis. This is related to diagnosis. Number one, diagnosis of hyper. How to identify? That means indicator. That means prompts, pointers, signs, symptoms. That is what it is. How do you diagnose? Is what. Next one. Use the word diagnosis. So text A is related to diagnosis of hyperthyroidism. Next, second one. Minimally invasive video assisted thyroidectomy. So this is thyroidectomy. B is about thyroidectomy. Thyroidectomy. Next, C. C is about testing. C is testing. First one is diagnosis. B is thyroidectomy. C is testing. And D is thyroid function test results and analysis. Analysis means research. Research. Analysis means research. So A is related to what? Diagnosis. Remember that one. So only these four words you have to take, nothing else. No need to read anything. I'm telling you. No need to read anything. So thyroid text. So this text A is related to diagnosis. Diagnosis. Remember. Don't read anything else. Yeah. This is related to diagnosis. Text A is related to diagnosis. Finished. Then text B is related to thyroidectomy. That's all, one word. thyroidectomy. It's so easy now. So already we have gone through that one. So he's giving a new text so that he will apply those things here. That's all. So thyroidectomy. Text B is related to thyroidectomy. Finished. A new text totally. So he's telling you don't read anything. For example. Okay, my guidance. Next one. C is a testing. 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 Mutation testing. Okay, testing. And D is after testing results. So this is results. Or analysis means research or study. Research. or results. Results will come after tests, you know that. Results will come after test results. So after the test, you'll get results. So there are four things now. I'm going to give you those four particular words. Those four particular words. Okay. Now, here, four subtitles, the subtitles for the new one, the subtitles. We already got it. Just earlier I showed you how to identify. Now I'm just identifying because I'm the student now. I'm identifying like that. The four subtitles. The four subtitles. What is the text here? Text here is thyroidism. Okay. Okay. See here. Thyroidism. Thyroidism. That is thyroid text. So thyroid. That's all. We'll write here thyroid. New text has come. Thyroid. The four subtitles. Now first one. Number one. Number one. Number one. Diagnosis. Diagnosis. Then go to number two. Thyroidectomy. Thyroidectomy. Number C. Testing. Number four. Results. Finished. I have given you that there. Results. Try to understand. These are the four different things. So this is text A. Actually, we have to give A, B, C, D. Okay, that's it. A is diagnosis, B is thyroidectomy, C is results, C is testing, D is results. We know that one. Very clear now. Now what I am doing is, I am taking this one and I am going to the question. Okay. Right, this is the question, suppose. So I am posting it here. And okay. Right. Fine. Now here, 1, 2. I'm creating a new style actually. So just bear with me. So this is, we'll say A and B and C and D. Okay. A and B, C and D. Okay, fine. That is done. Next one is, we'll make it half this side. Okay. And Control C will make another half this side. Okay. And what we will do is, we'll take this one and we'll take this one a little. Yeah. Fine. Now here, 1, 2, 2. Okay. Okay. Now it is okay. Okay. Right. 1, 2. Fine. Control C, Control V. Yes. Send it to back. Yeah. Now this one we can delete. Now we have 4 options here. This is one. A. Mm, A. Yes. Okay. Okay. So this is A. Number 1, A is diagnosis. And B, so 4 options. B is next time from tomorrow, every day I'm going to take, no? So that's why I'm making some format. Thyroidectomy. And C, so the same format I can use every time. Testing. C is testing. D is after tea, give me, no problem. Lunch I will have afterwards. Little late I will have. Please. Tea you give me. Thank you very much. D is results. So these are the 4 options. Finished. A, B, C, D. That's all. These are the 4 options. You have to remember. Now we can delete this one. So now here, in which text can you find information about identifying the risk of malignant cancer of the thyroid? So these are the 4 are the options. These 4 are the options. Now you have to find A, B, C, D. That is what your answer is. Thank you. You have to write the answer. So A or B or C or D. Just to think about that one. Nothing else. So we are not reading the paragraphs. We are not reading the paragraphs now. Without reading the paragraphs, you are going to identify this question's answer. So identifying the risk of malignant cancer of the thyroid. Where will you find? Identifying. Identifying. How do you identify? Okay. Where you will find? Will you find in the diagnosis, or will you find in the thyroidectomy, or will you find in the testing, or will you find in the results? You should remember that. So these are the points. The word keyword is identifying the risk of malignant cancer of the thyroid. How much risk is there? How will you identify? A, B, C, or D? So you have to understand that related word, and then you can give the answer. So this identifying the risk is related to diagnosis. Identify means what? Is it diagnosis, or is it results, or testing, or thyroidectomy? That is how you are going to identify. Next question. Afterwards, I'll put the poll in the Telegram channel. You can answer there directly. I'm just giving you some clues. Next question number 7. Question number 7. Without reading, how you will identify? That's what I'm showing you. So, question number 7. One, two, three, four, five. Yes, here. Next question. Okay, 7. Same format. Now we don't need much time. Okay, same question. Question number 6 is over. Now question number 7. Only this one will change. Okay, and this is 36. 36. And this is aerial. Yeah. Which patients are suitable for a thyroidectomy? Where will be thyroid? Which patients are suitable for a thyroidectomy? Suitability for thyroidectomy. Will you find in diagnosis? Or will you find in thyroidectomy? Will you find in testing? Or will you find in results? So, suitability for thyroidectomy, not thyroidectomy, suitability for thyroid. That means these patients are suitable for thyroidectomy. How do you? Thyroidectomy is the procedure. Suitable for thyroidectomy. Or it will be in diagnosis, or it will be in the testing, or it will be in the results. Next. So here, suitable is the keyword. And here, risk is the keyword. Identifying the risk. Risk is the keyword. Okay. Next one. Or identification, indicator may be the keyword. Next, question number 8. Question number 8. So, this is 36. Okay. 36 and A. Okay. Now you see here. Now, in which text can you find information about the symptoms of patients receiving insufficient treatment? Insufficient treatment. The symptoms. Try to understand the keyword here. Symptoms. Okay. They're not getting the symptoms. The symptoms of patients receiving insufficient treatment. They're not getting treatment. So what will their symptoms be like? Where you will find? Okay. So where, which A, B, C, D, which it will go? So here the keyword is symptoms. Symptoms. Next one. All the words which we have studied, they will come one by one. 8th one. Then 9th one. 9th one. Changing the dosage of thyroid medication. Changing the dosage. Changing the dosage. Dosage. How much dose it is to be changed? From what dose to what dose? Increase or decrease? Where will you find? Whether to increase the dosage or decrease the dosage? Where will you find? Okay. 36. Okay. So this is related to dosage. Dosage of medication. Dosage means medication. So where you will find diagnosis, thyroidectomy testing or results, where you will find. So the key word here is dosage. I am telling you how to identify where, which word to find out. Dosage. So 5 mg to 10 mg or 10 mg to 5 mg or 500 mg to 250 or 500 to 700 or whatever it is. Then next. Question number 10. Question number 10. So now, next question. Assessing the thyroid function. 36. So here is the next question. Assessing the thyroid function in those taking L-thyroxine. Assessment. What do you mean by assessment? Assess means examine. Assess means examine. I will not help you in any way. You have to relate. Assessment, evaluation, examination. Write down the words. I am not teaching you how to do reading. I am teaching you the methods of reading which you can apply. The most problematic thing is synonyms, and I won't tell you what is there in this particular one. You have to identify. Assessment, evaluation, examination. Then what you will find here? Is it diagnosis or thyroidectomy or a testing or results? Where you will get? Maybe here, little bit here and there, no problem, but you will reach. At least if you not get 100% answer, at least 50 you will get now. Guesswork, you have to think. You have to think. This is called logical induction and deduction. Logical induction and deduction is very, very important. Don't write any answers, please. Let the others also think. Let the others also think. Let everyone think. Afterwards, I'll give you time for testing. Okay, if you write the answers now, others will be influenced by your answers. Your answers are right or wrong, I'm not going to tell you. So no use of writing now. Afterwards, when I tell you to write, that time I'll give you the answers. And actually the answers will be automatically, you will know there. I need not give also. Because I'll feed the answer there in the poll. Next. So now I'll ask someone here. Manikanta. Hello, Manikanta. Manikanta, you can unmute. Okay. Fine. Datar Singh. Hello, Datar.
Hello.
Can you hear me? Can you speak? Okay, fine. Better I ask the old students. Sagara Priya. Hello, Sagar.
Hello, sir.
Yeah, you can hear me. Okay, you can speak. Now you tell me, there is one word in the question assessing the thyroid function in those taking L-thyroxine. Which is the most important word in this orange color or whatever color that in the middle, in the question?
Assessing, sir.
Huh?
Assessing.
Assessing. Okay, can you change that one into noun form? Can you change assessing into noun form? Okay, I'll help you. Assessment. Okay, I think your phone has gone mute. Okay, maybe. Okay, fine. So assessment, what are the synonyms of assessment? Who is there? Sudha. Or you, Veera? Anyone open the mic? Sudha or Veera? Don't wait that someone else will open. Come on. Okay, Linta. Linta. Hello. Hello, Linta.
Evaluation.
What is the important
sir.
word in the center? Question.
Evaluation.
Assessment. Okay.
Examine.
What are the synonyms of assessment?
Evaluation,
Examine.
examination,
Next.
examination,
Examination. Next.
observation,
Observation. Next. Okay. Now tell me in these 4 words which is related to that.
assessing, assessing,
Assessing is related to that one. Now in the 4 words given at the bottom, A, B, C, D, which word means assessing?
testing, sir.
Okay. So in this way, you can think about that one. That is, so you will go there directly. If you do
Yes, sir.
5 or 6 tests, it will be very easy for you. Right.
Okay, sir.
Question number 11. Question number 11. Yeah. Question number 11. Don't search for answers. Try to analyze the questions first. Yeah. Only the central question is important. All others are same. It only changes. Question number 11. Possible complications involved in thyroid removal procedure. So, procedure, thyroid removal procedure. I don't know how you are going to take what. I don't know. You are very clever. I know that. It's not very difficult for you. I know that. Now here the question number 11 is, in which text can you find information about possible complications involved in thyroid removal procedure? In which text you will find? A or B or C or D? That is what you have to tell me. So try to understand possible complications. Where do you find a possible complications? Possible complication involved in thyroid removal procedure. Procedure. Try to understand which is the key word here. Okay, I'll give you this question to one person. Anyone. Okay. Right. So, possible complications involved in thyroid removal procedure. Okay, remove the complications. Now, somebody raised their hand. Very good. Jyoti. Yes, unmute.
Yes, sir.
Yeah, Jyoti, tell me. Possible complications involved in thyroid removal procedure. What is the most important word in this one?
Thyroid procedure, that is thyroidectomy.
Yeah, procedure. So procedure means what is procedure? Where will you find? Automatically you will go to A, B, C or D. So this is how it is. You have to find out like this. Okay. Fine. Next one. Next one, short answer questions. Next one is short answer questions. Right. Now, short answer questions. Question number 12, part type 2. Okay, set 2. Set 2. Okay, this is set 2. Set 2. And these are short answer questions. questions. Okay. Okay. Question number 12. Question number 12. Okay. Copy here. Okay, 36 Arial. Okay. Now see this question. What will the level of FT4 be in patients undergoing thyroxine replacement therapy? Therapy. You know what is therapy? So in this, during this therapy, okay, what will the level of FT4 be? So therapy. Therapy means what? A diagnosis. Therapy means what? Thyroidectomy. Therapy means testing. Therapy means results. Now I'll give another girl, any new person, new candidate, an option. Okay. Shilpa. Hello, Shilpa. Yeah, Manikanta. Yes. You can unmute. Yes. Manikanta. Okay, Mary Dorin. Okay, Mary.
Sir.
Now here is the question, Mary.
Sir.
Here is the question. Without reading,
Yes,
can you understand something here?
What will be the level of
Huh?
yes, the level of FT4 will be the level of free thyroid
Yeah.
in patient.
Okay. Where will you find according to your expectation A, B, C or D? Oh,
Testing, sir. C.
okay. So will you find in B or A or B or C or D? So the most important word is thyroid replacement therapy. Okay. Thyroid replacement therapy. So there you have to see and you have to understand. So level is, so there you will go and afterwards you will find what will be the level of FT4. Level means something will come, high, low, moderate, or some level of numbers, statistics will come there. But we don't want all those things. Where will you find the information? That is enough. Oh, sorry. So here, first you have to go there. Then you have to write the answer here. A, B, C, D. So here, the answer will be, answer you have to write. Here you will get the answer. What is the answer? There you have to go. A, B, C, D. Then you have to find what is the level. Value of that one you have to write. So for finding that answer, first you have to know whether it is A or B or C or D. Then after going there, you can find. But first you should know which paragraph you have to go. That means for all the 20 questions, you need to know which paragraph. Not only in 7. In 7, only we need to know which paragraph. But from 7 onwards, 8 to 20, you should know which paragraph and what is the answer also. That means they are double questions. First step is which paragraph you have to identify. then after going there, you have to find the answer and then write. In the first paragraph, you only should write which paragraph, A, B, C, D, that's all. But in this other questions, you have to go to the paragraph, A, B, C, D, which one, then you have to find the answer, and then you have to write. That means it involves 2 steps. So that means which paragraph, A or B or C or D, is required for all the 20 questions. Now you understand what I am talking. So for every question, you should find the word and relate to which paragraph. If you relate it, your time will be saved. Otherwise, you have to read all the 4 paragraphs. That is what I am telling. Okay. Next. 13. What should patient who are taking L-thyroxine do if they notice arrhythmia and mood swings? That means do's and don'ts, regulations, prohibitions, permissions. That is what it is. What should they do? Not do. What should they do? That means do's. What should they not do? Means don'ts. So all the types of questions are related to what I told you earlier. That is what I am showing you here. So afterwards, you have the text with you. You can do the test and you can find the answers. Answers are also there. Answers are also there. So you can find the answers and you can check. Otherwise, I'm going to place these questions in the Telegram group. Afterwards, you can do the questions and ABCD you can tick and there you will get the answer. Control C. $36. Okay. Okay. This is better. Fine. Yes, coming. So this is the question. Next question, 13th question. This is the 13th question. So what should patients who are taking, not there now. What should patients who are taking L-thyroxine do if they notice arrhythmia and mood swings? Okay. So here try to understand. So do's and don'ts. Do's and don'ts. So where will you get this one? What should they do? You have to find out that one. Should is the keyword here. Should is the keyword here. What should they do? Is it regarding diagnosis? Or is it thyroidectomy or testing or results? Where you will find this one? Next. $14. I'll put all these questions. Now only think where it is related, what it is related, like that one. Afterwards, you can go to the paragraph and you can find out and you can do the answer. That is, you have your choice, no problem. But just think, what are these words related to? So 14. $36. Yes, next one. Now let us see here. Which type of thyroidectomy has an increased chance of morbidity? Type of the type. Underline the word type. Thyroidectomy. Which type of thyroidectomy? Now you understand very clearly which area it will go. Type of thyroidectomy. Type, class, category. I told you these words will be there in each and every question. Cause, result, type, medication, rules and regulations, advantages, disadvantages, management, diagnosis, treatment, all different groups. They will definitely come in the questions. So you should identify what is that keyword which will help you. So this is which type, means which group, means which class, which category. That's what it is. I'm just telling you to identify the word in the question which is pivotal, fundamental, which turns the point and focuses, I am very important. So which type? Type is very important here. So he's talking about the class of thyroidectomy. A class of thyroidectomy. So where will you get this one? Yes, Jyoti. Yes, Jyoti.
Yes, sir.
Yeah?
We will be going to the procedure type of thyroidectomy.
Yeah. So this is how I'm not asking about the answer. Yes, you are reasonable. You are reasoning properly. But what I'm telling is identify the word in the question which will take you to the answer. That's what the key which opens the lock. That is what I'm telling. Fine. Next one. Okay. Sorry. 14, 15, 15. Yeah. Test results. Okay, results means output, input, process, output, input, process, output, initial, medial, final. Input is initial, output is final. Outcome is production. Okay. Initial, medial, final. So you have to identify like this one. Cause, effect. Cause, effect. Advantages, disadvantages. Pros and cons. For and against. Like this, there are some concepts. You have to identify that one there. Next. 15. Yes. Now see here, test results for a patient with subclinical hyperthyroidism will show what level of FT3. Level, test results. Test results. So which is the most important word that will take you to the paragraph A, B, C, D. Afterwards finding the answer. If you can identify which paragraph it is very easy for you to go. You will save your time. Okay. Learn the synonyms, learn the meanings. Next. 16. What can be tested for using a commercially available kit? What can be tested? What can be tested? So their clue is there already. 36. One word. So what is the key word which relates to the A, B, C, D? What can be tested for using a commercially available? What can be tested for using a commercially available good? Tested. Test means what? Assessment, examination, evaluation, and what else? That is not my problem. You can think. Only I am making you think now. Automatically you will get the answer if you start thinking like this. There are some students who are getting 36, 38. I'm not joking. And I have put, recently I have put those marks in the group also. Fine. And I tell you every day, do one reading, listening, and send your marks to me. Next. So the key word here is tested. Right, question number 17. These are sentence completion. That means fill in the blanks. So, sentence completion. Yes. Here it is. Sentence completion. So where will you find this information? Fill in the blank. We don't want the answer now. We should know where the point is. Yeah. Today you do this test, you will get how many marks you see. Okay. You will know the difference. Forget about others. Empty vessels make much noise. Okay. We are not empty vessels. We are strong ones, filled with lot of knowledge and wisdom. Okay. So try to gain that wisdom. If thyroid function tests indicate, if thyroid function tests indicate the TSH has a dash, this could suggest heterophile antibiotics. Tests are indicating, pointing, signs, symptoms. Indicators, pointers, times, symptoms, prompts, clues, cues. Already I told you, indicate. What all I told the words, are they there or not? Okay. What all the words I told you, are the words there or not in the question? Indicate means a direct, a point, a show, reveal. Point, show, signs, symptoms, cues, clues. So same words are coming everywhere. So learn that these words are very important and learn the synonyms. If he says points out, that reveals, that means indicates. These are family of words. Yeah. So 3 more questions, I think. Afterwards, we'll have lunch. Okay. Then you can do this test. I already sent the test to you. Part A you can do. You can do part B and part C also. But you do part A like this one. How to study these things. It will be very easy for you. It's okay if it takes little time. Instead of 1 hour, you take 1.5 hours. No problem. Now, today, because you are learning a new technique. Then next one. 18. Following a thyroidectomy means after thyroidectomy, yeah, right. Following a thyroidectomy, if the patient experiences aphonia, this suggests, what suggests? This suggests signs of symptoms suggestive of. This suggests means this indicates. Again, it is there in a different word. I have taught you many words. Still another new word has come. Do you realize this? I have given you so many words. I did not say suggest, but that has come here. This suggests. Signs and symptoms are suggestive of. This sign suggests pneumonia. This symptom suggests diarrhea. That's it. Suggests is another word which means indicates. Identify. The word is suggestive. Suggest. This indicates. This points. This reveals. You can use all these words there because they are synonyms. Try to understand that keyword suggests. Suggests. Okay. Next. I'm just showing you the keywords. What are the words you have to search for? $19. Okay, 3 questions are there. Last. Okay. If tests reveal, try to understand revelation. I told you in the morning, reveal. That BRAF V600E mutation is present. If the test indicate that the BRF V600E mutation is present, if the test confirm that this mutation is present, if the test show reveal is another word. So what is the key word? It is extremely likely that the presentation has revelation, reveal, indication. Indication, where will you find indication? In diagnosis or in testing? Testing. When you test, you will know the fact. Signs and symptoms are not facts. Signs and symptoms are not facts. You cannot 100% say because of signs and symptoms. Signs and symptoms may reveal 2 or 3 problems, and 2 will be ruled out and 1 will be finalized in the later stages. So, what do you mean by reveal? Revelation. Earlier it was not open, it was hidden, nobody discovered, nobody found, now it is revealed. I am revealing the techniques to you for reading. Next. Learn the importance of synonyms here. Then 20. Okay. During a thyroidectomy, the endoscope is inserted into a cut made in the dash. During a thyroidectomy is there here, see. During a thyroidectomy, the endoscope is inserted into a cut made in the dash. So this is a procedure. During means procedure. Before the procedure, during the procedure, after the procedure. Pre-thyroidectomy, while thyroidectomy, post-thyroidectomy. I am teaching you another rule now. Write down. Pre, while and post. Procedure. Pre-procedure, while procedure, post-procedure. Pre-procedure means what you do before the procedure. While procedure means while you are doing what are the things you are, what steps you will take. Post-procedure. Pre-procedure, cleaning, arranging, checking, or something like that. Then while procedure, steps. First I have to do this. Second I have to do this. I have to cut. I have to insert. Then I have to clear. I have to clean. Then I have to then seal. Then last one, post procedure, cleaning, washing, applying bandage, or whatever it is. So pre, while, post. This is one stage. So here during is the key word. During, in between that time. During means while. While, during is very important word here. During the procedure, during a thyroidectomy. So you should know which word is very important. Result means outcome. During means process. During means process, procedure. Next one, last question. Okay, after the lecture is over, immediately don't run. Okay? Relax, have lunch, then afterwards come back to me, no problem. I'm going to correct your writing papers. Okay. Okay. To optimize a hypothyroidism treatment, dash can be used to detect. Detect means identify euthyroidism. Once the current treatment is stopped, detect, find out, discover. Okay. Detection. Searching, researching, finding, probing, studying, analyzing. Okay. So that is the word here. Detect, detection. You have to find out. You have to probe, you have to search, you have to research, you have to study. Write down the words. Okay. Now what you do, if you go to the passage, it will be a little bit easier for you because you already know the synonyms. You know what you have to see. You know where you have to find the answer. So 50% of the time will be saved for you. Okay. Right. So if you follow these techniques, it will be beneficial for you. Right. So we'll break. After the break, we'll have lunch. Okay. Then afterwards, we'll continue the session. Come for writing. Okay. Come for writing. No problem. I'll correct your papers. Right. And I'll correct for those people first, those who did not get correction yesterday. First them. And then next I'll correct yours. Okay. So you can just type your name there or raise your hand for correction, writing correction. I have posted in the morning only. Tag that one and say you are just with your hand. Okay. I'm showing you once again. Tag, raise your hand. Raise your hand. Okay. Where is that? Grand Gallery. Yeah, here it is. So I have given you some names here, numbers here. Maybe up and down I'll go. Don't say that I raised first or something like that. I'll definitely take you. But only the thing is, here it is, letter corrections for your those. If numbers are not raised, hands are not there. So I'm giving you here again. That was for the lecture. So if your names are not there, you can message me. Okay. And I will see yesterday, those who did not get, or day before yesterday, for them I'll correct first. And immediately afterwards, I'll correct others. Okay. If you want, ask me. I'm there to correct you. But only no, don't worry about anything. Just ask me, call me, just raise your hand and go off. I'm calling and nobody is responding afterwards. Okay, no problem. You contact me, I'll message you and follow it up. If I don't say, I'll call me and take the timing, what time you prefer. If you're not available, tell me. There are some students who told, sir, I'll come in the evening 6 o'clock or 8 o'clock because I'm busy now, I'm duty. So like that, you tell me something. Okay. And don't, no need to panic there. Just follow it up. Follow it up. I'm giving you, I'm with you only morning to evening, I'm with you. But only the thing is you have to follow up. Okay? Middle of the night, I am there. Right? I'm doing something busy. Okay? So just relax and follow up, send a message. Okay, fine. So now lunch break for us. We'll meet after the break. Fine. And now in this, how many are going for the exam next week? Raise your hand. Those are going for the exam next week. It means 7th. Yeah. Rabjeet, yes. Anybody else? Okay, fine. No problem. Right. So, hope you have understood the importance of these things. I have sent the question paper. Take the question paper and try to answer that question paper and check your answers. Okay. Anybody has any doubts? Now the doubt session. Doubt session. Yeah, Jyoti, send a message there. Raise your hand there now. Raise your hand there. Tag that question. Writing corrections. Tag that one and raise your hand and I'll follow it up. I'll put the name. Okay. Doubts session. Any doubts you have? Okay. Doubts session. Who is this? Doubts session. Yes. Doubts session. Yeah. Now Jyoti has raised the hand. So what I'll do? I'll just add here 13 number. It doesn't mean that 13th will be 13th. It may become first or second or anything according to the order. Okay, or importance. If the requirement is there, emergency, I'll give them first, no problem. Okay, if there are some students who can understand, okay, little late, I'll correct, they will not feel bad. So I'll tell, okay, right? Next one, this is Jyoti. So I have sent you the question papers. Okay, you can complete those and you can prepare, and listening also I sent, and I will send you the audio also now after lunch. I'm little tired. I need some rest after lunch. Okay. Immediately don't send message saying that correct mine now, right now, sir, like that. So I'll follow it up. No worries. Okay. I have given 13 number. So any doubts anybody has, I have already unmuted. You can raise your hand or you can open your mic and you can ask any question if you want. Okay. Datar Singh, do you have any doubts?
No, sir.
Okay. Is that clear to some extent what I'm telling you? What first step? What is important?
To find the keyword.
Find the keywords and identify the synonyms.
Yeah.
Okay. And today many students will be writing and putting it in the group. Prabjit, Prabha, anybody else?
Yes,
Prabjit, did you write some words, keywords?
yes, sir. I wrote.
Yeah, put them in the group, please.
Okay, sir.
Okay. Next. Anybody else? Jyoti, if you have written, put them in the group. Okay. Next. Manikanta.
Sir, good afternoon, sir.
Good afternoon, Manikanta. Did you understand the basic point?
Yes,
What
sir.
is it?
Yes, sir.
Which identifying the hero of the sentence is more important. Okay.
Okay, sir.
In the group of people, who is the hero? You have to identify. If that you identify, then the lock will be opened. Otherwise, it will be difficult. You'll be only struggling. What is it? Okay, fine. So whenever I send a message like this, okay, immediately what you have to do is you have to underline that, find the synonyms like that. Okay. Next,
Okay, sir.
Yogendra.
Yes, sir. Good afternoon.
Good afternoon. You understood some points, right?
Yes, sir. Definitely.
In the next session, we'll go a little more. Okay.
Okay, sir. Sure, sir.
Right.
Thank you,
Sagar.
sir.
Sagaram. Okay. Is that clear to you to some extent?
Yeah, clear, sir.
Okay. Okay. Make a list of all the things which I told you. They will put it in the group. You also might have written. If you have written those words, you can post it here. Okay.
Yeah, okay, sir.
Right. Sudha. Yes, Sudha. Unmute and tell.
Sir,
Yes,
this
dear.
session is very helpful, and I have a doubt, sir. You mentioned scanning has 4 parts, names, numbers, non-vocabulary, important vocabulary and difficult vocabulary, right?
Yeah.
Okay, then how
Names,
to,
numbers, new words, difficult words, and special phrases.
sorry, sir, last one?
Special phrases. Special phrases means idioms,
Special. Okay, okay, okay. That's I didn't
quotations,
get. Okay, okay.
like that.
Special.
Special phrases. Okay.
Okay, okay.
This is you
Then
afterwards
all
you have to follow
all
it up.
part
Okay, fine, fine.
part is like this way only, sir. We can
Yeah.
all part A
Ah.
question. We can get answers like this way.
Yeah, all the answers you will get like this way.
Okay, okay, sir.
I am going to
All-
show you. No, afterwards you complete this one and you ask your questions and I'll explain you. Okay.
Okay.
After
Okay.
the lunch, yes, Manikanta. After the lunch, now it is 3:56, means 4. So we'll meet again at 5 o'clock or 6 o'clock. We'll have listening session. How many of you are interested in listening session part A? Part A listening, I'm going to take at 6 o'clock or 7 o'clock. So I'll put it in the group. You can join that time. Okay, fine. Okay. Right. Okay, bye for the day.